Well, was COVID-19 on our island earlier than we thought? Stony Brook University Hospital says yes, as early as the first full week of February. We have Dr. Adam Singer joining us now from Stony Brook Hospital. Thank you for being with us, Doctor. What exactly does this mean?
Well, I think that it's not surprising that we're beginning to discover all over the world that we probably had early cases far before we were identifying them. Remember that a lot of the symptoms of coronavirus also overlap with the flu. So until we started seeing cases that were more severe and more common, it was thought to be the flu. So I think it's not surprising when a new disease comes out that it'll take some time to figure out what's going on.
Now, since then, the hospital has seen close to 5,500 such patients. What have the patients been telling you?
Well, what's interesting, especially after the news of this case or these potential cases came out, I've had a number of emails from patients who say, you know what, I had symptoms like that in January. I had symptoms like that in early February. Do you think I had COVID? And I can say, you might have, you might not have. And they want to know what to do. And I say, well, you should be happy that you got it and it wasn't that severe. If you want to know for sure, you should get one of these antibody tests when they're available more widely. And if it's positive, it means you likely had it and you likely are less likely to get it again.
Last question, Dr. Singer, if you can tell us what changes are going to happen going forward.
Well, I don't think it changes a lot for patients who get sick now, but I think as a population, I think we need to do more surveillance in the future to see if we can identify early cases for the next wave or other pandemics that come so that we can have a jump start on getting ready.
How did you guys figure this out, that it came out so early? How did it come to be?
Well, I think everyone was hearing about what was going on in China, and so we were very proactive at our hospital in getting prepared for the potential pandemic. And so we entered a new order into our system called a person under investigation, and that was really anyone with flu-like symptoms who was coming out of China or Iran or any of those countries. So very early, we were identifying these patients, and we don't know if they did or did not have COVID, but certainly we began monitoring for this very early.
Okay, and so you determined with at least one patient that he could be or she could be a suspected COVID patient, and then you monitored them from that point on?
Yes, but also patients like that were referred to the Department of Health and the CDC, but the recommendations and guidelines for testing and evaluation were constantly evolving and changing. Every day it was something else. So it was hard to keep up with this. And that's why things changed. But really, the pandemic started to really grow at the beginning of March. And I would say we probably peaked about April 1st.
And some people were saying that maybe this has been going on longer than February, but as far as you know, it was around February 7th, correct?
Correct, but remember that I'm sure there were a lot of people who had flu-like symptoms in December and January, and who knows if it was circulating then. You know, today with the global industry and travel, it's very easy or very likely that somebody who got the disease in China or Europe or anywhere else where it evolved was on a plane and coming to us, early. We just didn't recognize it. So it's very possible that it's been going on for a while. You know, there's an estimate that there were 10,000 cases in New York before people recognized it. So it's not surprising given the disease and its overlap with many other viral illnesses.
So certainly a very interesting topic. I'm sure that, you're taking everything in as well. How do you feel being a part of something like this report?
Well, certainly, I think that I'm very privileged to be able to help people better understand the disease, better prepare for the disease. And I certainly want to also acknowledge all of the wonderful people at Stony Brook and all the healthcare workers and all the nurses and housekeepers and everyone who's worked so hard. And we really feel that this is our mission, is to help save lives and to help people. And so we really do feel energized and feel like we're doing a great thing for everybody.
You certainly are, and a lot of people are taking note of that. Thank you so much for joining us, Dr. Singer.
Thank you.